Hi, I'm Elizabeth Miller. I find working with our residents in a nursing home rewarding, taxing and perplexing, sometimes all of this within one shift. Allow me to share some of what I'm currently learning. Dementia is a group of diseases where the brain is so severely damaged that it causes confusion, affects memory, coordination, judgment, language, behavior and personality, causing havoc in their daily life and in relationships. Did you know that over 2/3 of aged care residents have moderate to severe cognitive impairment and that 80% of those with dementia require high-level care? Communication is more than transmission of information and meaning. It is actually vital to a species' survival. Once the gift of language, which is unique to human beings, is lost, changed behavior is the means for communication. Effective communication is especially important in a dementia care setting. Why? Well, Kitwood said that people living with dementia have the same needs as you and I. But because of their brain impairment, they struggle to convey to us what it is that they need. Tanner and Lipinska stated, cognitive decline makes the use of language more difficult. While Morris and Morris wrote, we know what we want, but we can't say it. In my view, we are not cognitively impaired, but communication impaired. Most people who move into a facility, such as a nursing home, have complex needs. They expect to be cared for, and we as staff, we work hard to facilitate exactly that. When our elderly say they miss home or they miss family, they usually refer to the need for attachment, inclusion, identity, comfort and occupation. Residential care environments with their large communal spaces, incessant commotion, noise and rigid schedules, and where residents are prevented from helping to run their home and control it, can cause them significant stress. Many of our elderly are hearing impaired. They struggle to understand staff and make themselves understood by them. Remember, we have many different languages represented and many different dialects and accents. And the situation is especially difficult when, like during the pandemic or even still now, masked and gowned figures add insult to injury as they flit about, shoving probes into residents' noses. Is it any wonder we see some unusual behavior? According to the unmet needs model by Cohen-Mansfield, people with dementia often display inappropriate behaviors because of unmet needs and the difficulties in meeting these or communicating them. This heightens their suffering and makes caregiving even harder. Now, when again I scrape Gloria's cappuccino off the wool, I think of the unmet needs model and feel less offended. This makes a considered response much easier. You will recognize other common behavioral expressions associated with unmet needs. For example, Lars, who asks time and time again, when is the exercise happening? I now point to the daily program on the notice board and say, look, it's posted there. Jackie, who constantly follows others, could express her need for attachment, security and comfort. She does better when she is on her own less. Enjoy a chat over a cuppa with her, or include her in simple tasks like folding tea towels. When you come across fidgeting, agitation, crying out, hiding things, hoarding, or even aggression, investigate the 5 basic human needs and see if they are met. If not, do meet them if possible. Is the person hungry or thirsty? Is she tired? Did she sleep through the night? Does she nap too much during the day? Are there any issues around toileting to be considered? Is she hot or cold? Is it too noisy, too bright or too dark? Is a personal space invaded by other residents or even carers? If the person resists care, you may look for ways to create a warm, calm bathroom atmosphere with their favorite music. Be gentle. People with dementia are often in pain. Be mindful of nonverbal communication. Your body language. The face is the best communicator. Position yourself in front of the person. Make eye contact. Watch for posture, gestures, tones of voice. It all plays a huge role. I recommend the positive physical approach in many other situations, but especially when one comes across agitation, refusal of care, or aggression. For example, stop 6 feet out front in a public space. Look friendly and make the hi sign with a hand. Offer your hand. Make eye contact. Approach from the front and move slowly. Initiate the greeting and introduce yourself. Keep shoulders and face back. Respect the intimate space. Use a supportive stance, like stand to the right hand side and not in front. Get to their eye level, staying at arm's length. Wait for their response before continuing. Make positive statements, for example, let's try such and such, or shall we do this? And then show what you want the person to do with your body. Or could you please help me do such and such? Deepa Snow is an absolute expert and has some wonderful material on that. McCarthy said, empathy and imagination are the foundation of good person-centered communication. Build on those with verbal and non-verbal communication. Carl Rogers defined empathy as sensing the person's private world as if it were our own. While Morris talks about the importance of validation, the empathetic listening without judgment of their perceived reality. Allowing the expression of painful feelings will cause them to diminish, and that underneath that behavior sits a need which drives it. Person-centered communication implies respect, trust, self-determination and understanding. Don't say, there you go again, you whiner, you're such a baby, pull yourself together, you make me sick. No. Person-centered communication sees the person with dementia as an individual of value and takes his perspective and social context into account. Leaving people dirty, unkempt and unattended violates this principle. Person-centered communication sees the world from the perspective of the person with dementia, taking the history into account. In summary, person-centered communication is a most needed skill in any dementia setting. It is not instinctive, and you will make mistakes, but we all can and we all must learn, and keep learning and keep learning. Thank you so much for listening.